Good evening, Debbie.
Hi.
Hi, my name is Teresa and I am a nurse practitioner student with Valdosta State. I would like your permission to use you for my assessment video today. Would that be okay to record you?
Yes.
Okay, great. State your first and last name for me.
Debbie Nickel.
Okay. All right, so we're going to get right into it. I'm going to start with your abdomen assessment, okay?
Okay.
So Debbie, I'm going to have you lay down flat on the table here.
Okay.
Perfect. I'm going to pull your gown up. I have washed my hands. I have gathered all of my materials, and we're going to go ahead and start. All right, so the first thing that I'm going to look at is inspect for her color, temperature. I'm going to look for the presence of any scarring, any bruising, any nevi or moles that we need to be watching. Temperature is good, color is appropriate. The next thing I'm looking for is the presence of a Cullen sign, and that would be a purple or bluish discoloration on the periumbilical area. If I were to see that, I would be concerned about a intraperitoneal bleed. However, Cullen sign is negative. Okay. Now I'm going to move on to listening to your abdominal arteries, okay? So this time I'm going to use my bell of my stethoscope, okay? And I'm gonna start with your abdominal aorta right up here. Okay. I'm gonna move on to your right renal. Okay. And your left renal. Okay. And then I'm going to move on to your left iliac. And what I'm listening for is the presence of any bruits, which would be a whooshing sound. That would indicate stenosis, potential stenosis anywhere. And I'm not assessing for any bruits. That was left and right iliac arteries. Now I'm going to go right femoral. Okay, and left femoral. Okay, I don't hear any bruits, so that is a normal assessment. Now I'm going to flip it around. I'm going to listen for your bowel sounds, okay? I'm going to start over here in your left lower quadrant, or your right lower quadrant. Okay, then we'll move up to the right upper quadrant, and what I'm listening for is the presence of bowel sounds. I want to hear that they are normoactive. If they are hypoactive, I would be a little concerned. If they were hyperactive, we would be concerned about increased gastric motility. And then if they were absent, which to confirm, you must listen for 5 minutes in each quadrant. If they were absent, that is also abnormal. But you have normal active bowel sounds. Okay, now we're going to move on to percussion. Okay, so I'm going to tap on your abdomen, and what I'm listening for is the sound of tympany. That is normal. Until right about here, where it has changed to dull, and that indicates the level of the liver. Okay, we're going to go on this side. Okay, and right around here, it has changed to dull again, which is the level of the spleen. Okay, so that is percussion. Now we're going to do the liver scratch test. I'm going to use my diaphragm for this. Okay, I'm going to place my stethoscope right about here, and I'm just going to scratch kind of up your side until I hear a sound change. And there it is. That indicates to me that that is the border of the liver, and it's in the proper location. All right, next we're going to palpate. So I'm going to start with light palpation. That's going to be one hand, 1 centimeter deep, starting right lower quadrant. And I'm just feeling for the presence of any masses, any cysts, any abnormalities, and that all feels good. So then we're going to do deep palpation, which is 2 hands, 2-3 inches deep. Go nice and deep here. This is good for feeling for enlarged organs. Again, I'm feeling for anything out of place, any masses, any cysts. Okay. And all of that feels good. Was there any tenderness while I was doing that?
No.
Okay, and I didn't notice any guarding as I was doing that, so I would say that is a normal abdominal assessment thus far. Okay. Now I'm going to feel for your spleen, okay? So my hands are gonna go right around here. I'm gonna make them into kind of a hook motion here, okay? I need you to take a deep breath in. Okay, breathe out. Okay, excellent. And what I felt there was the border of the liver. It pressed against my fingers, so that indicates that it's in the right anatomical location, size. Okay? Now I'm going to palpate, or rather not palpate the spleen. If I were able to palpate the spleen, that would be concerning because it should not be palpable. So I'm just going to reach over here, pull a little bit on your side, and I'm not able to palpate the spleen. If I were, it would indicate some splenic engorgement or enlargement. All right. Now we're going to do Murphy's sign for cholecystitis or gallbladder inflammation. So my hand's going to go right here again, kind of in that similar hooking motion, okay? And what I need you to do is take a deep breath in and out. Again, in and out. Okay, any pain as that was going on?
No.
Okay, good. If there were pain on inspiration, it's called inspiratory arrest. The pain with gallbladder inflammation would be so intense that she would not be able to inspire without pain. That would be a positive sign of cholecystitis. But that was negative. All right, now we're going to do the psoas sign. The next couple are going to be testing for appendicitis. Debbie, go ahead and lay on your left-hand side for me. Okay. All right. Move towards me a little bit. Move back towards me some. Yeah, there we go. Okay. That's it. You got it. All right. Put your legs straight out for me. Okay. We're going to do something called the psoas sign here. And what I'm going to do, I'm going to need to take this leg, right leg, make sure it's on the right side of the body. Appendix is located here. I will pull this leg towards me. Okay. And I need you to tell me, are you feeling any pain?
No.
Okay. Now, if this motion did elicit pain right in this area, I would be concerned about appendicitis. Okay? And that is the psoas sign. Go ahead, back on your back. Okay. Now we're going to do the obturator muscle test. Okay? And that is where I'm going to take this leg. We're going to go up. We're going to go in. And we're going to internally rotate and externally rotate that knee. Any pain?
No.
Okay, wonderful. Go ahead and rest straight. If she did feel pain during that time, then I would be concerned again about appendicitis. Okay. Now we're going to do McBurney's point. Next test for appendicitis. I'm going to go on the right side, midclavicular line, about halfway to the umbilicus. I'm going to palpate nice and deep here and fast. Any pain?
No.
Okay. If there were pain, I would be concerned about rebound tenderness, guarding. Those would all be indications of, if there's pain on release, those would all be indications of appendicitis. All right. Now, I'm going to have you sit up now on the edge of the table because we're going to move on to your joint inspection. Okay. All right, Debbie. So first I'm going to take a look at your hands. I'm going to take a look at your wrists. I'm going to take a look at your metacarpals. I am feeling for the presence of any crepitus, any nodules, I'm looking for any redness, any warmth, any inflammation, any abnormalities, which I am not assessing. I'm going to do the same thing on your knees. You are a gardener. You use your knees a lot. So I'm going to go here as well. I'm looking for symmetry. I'm looking for presence of any inflammation, any warmth, any crepitus under there. And then I'm going to do the same thing on your ankles. I'm going to especially test here for any swelling or edema, any warmth, any redness, any crepitus, any nodules on both sides. All right. And all of your joints seem normal. Okay. Now sit up nice and straight for me. Okay. I'm checking her posture alignment. I'm looking to see that that spinal cord is nice and straight here. Next, I'm going to check your capillary refill. Capillary refill is going to tell me whether or not you have compromised blood flow in your upper or lower extremities. So hand me your hands. I'm going to squeeze your fingertips. And what I'm looking for is a flashback of blood in less than 2 seconds, 1 to 2 seconds. They're gonna go from white to pink in 1 to 2 seconds. If that takes longer than 2 seconds, then I'm gonna be concerned about compromised blood flow to the extremities. I'm gonna do the same thing bilateral lower. Okay. And capillary refill is normal, which is less than 2. Okay, now I'm going to feel for your pulses. All right, and +2 is normal. Okay, so I'm going to feel for your radial. Okay, +2, normal even bilaterally. Okay, and feel for your brachial. I'm going to take this off.
Okay.
So they can see what I'm doing better. Thanks. There you go, brachial. 2+ equal bilaterally. I'm going to go down to your feet. I'm going to feel for your dorsalis pedis at the top, bilaterals. Good. And we're going to go posterior tibial right behind this ankle joint. And all of your pulses are 2+ normal. Okay. Now we're going to move on to some range of motion testing, Debbie. So I'm going to need you to stand up for this part.
Okay.
Okay. And let's see. Maybe come over here. I think some of these tests we can do on this side. Let's move right over here. Move the camera. Okay, I think that'll work for right now. All right, so Debbie, next we're going to do some range of motion testing, okay?
Okay.
So we're going to start with your neck.
Okay.
Okay, so I need you to do chin to chest, look down. Okay, that's neck flexion, look straight ahead. Now I need you to look up at the sky. Neck extension is intact. Look even farther up at the sky. That is neck hyperextension, which is also intact. Now we're gonna do some lateral bending. Take your left ear to your left shoulder. Good. Right ear to right shoulder. Good. That is intact. We're next going to do rotation. So look to your left, look to your right. Great. Now we're gonna do the same thing against resistance. Look to your left and look to your right. All right, neck is 5 out of 5 for resistance strength. All right, so that's the neck. Now we're going to move on to the shoulder. Okay, so go ahead and push up. Yeah, there you go. All right, so 5 out of 5 shoulder strength resistance, which is normal. All right, now we're going to do adduction and abduction of the shoulders, okay? So for this one, I need you to take your hands, I need you to go in a big circle and go to the top, make some prayer hands. So as we were moving towards the body, that was adduction. And right here at the top of these prayer hands, her shoulders are in abduction. Okay, you can rest. Okay, now we're going to do some internal and external rotation of your shoulders. Okay, so I'm gonna have you turn around and face the camera.
Oh, face the camera.
I'm sorry, your back to face the camera. Okay, now I'm going to have you cross your arms across your back, kind of at the level of your bra strap. And here we can see that your arms are internally rotated here, normally. Your shoulders are internally rotated. Now take your hands and put them behind your head, as though you're stressed out. Okay? And now shoulders are in external rotation, and that is normal. Go ahead and relax. All right, now we're gonna do forward flexion, okay? So I'll have you turn around and face, or kind of go to the side here. Okay. So I'm going to have you take your hands and we're going to swing them in a big circle forward. Good, forward flexion, and then behind your back. Hold them just like that, straight behind your back. Come forward for me. Oscar, you gotta go. You gotta go, buddy. You gotta go. Okay. All right. Now we're going to, I'm gonna have you extend your hands a little bit more. Go straight out, okay? That is hyperflexion of the shoulder, okay? And now go even farther out, as far out as you can, okay? And that is hyperflexion. The previous one, I'm sorry. Okay, go back. All right, go like this. Okay, this is extension of the shoulders is intact. Now go even farther back. Okay, that is a hyperextension of the shoulders. Okay, now we're going to do the aptly scratch test. So Debbie, turn around, and I need you to pretend that there's a scratch in the middle of your back that you need to get to, but you can't. Right in the middle. Go ahead and cross those arms. Perfect. All right. Any pain?
No.
Good, and she's able to do this appropriately. Let's try it on the other side. Okay, that is the aptly scratch test as well, and I'm testing for any pain in the supraspinatus muscles. Okay. Now we're going to do the elbow. So go ahead and turn around and face the camera for me. Okay. We're going to flex the elbows up, okay, and extend them down. Flex, extend, okay. And now I'm going to pronate and supinate. So I'm going to turn the camera a little bit so we can see. Okay. All right. So, we did it. I need you can see everything. All right, great. So this is baseline. I need you to go palms up, okay? That is elbow supination, baseline, go back down, pronation, okay? Baseline, let's go up, supination of the elbow, and palms down, that is pronation of the elbow. Let's do it on the other side as well, okay? Pronate, good, supinate, good, pronate, good, supinate, good. All right, so that's the elbows. Now we're gonna move on to the wrist. Let me see your wrist here, and again, this is another joint. Fix the camera. All right, and again, this is another joint. So just like with the others and with the fingers, I'm looking for crepitus, warmth, inflammation, redness, swelling, any presence of abnormal nodules, anything like that. All right, negative. So what I need you to do, we're going to test your wrist flexion. Okay, so point your fingers down, that's wrist flexion. Okay, point your fingers up, wrist extension, point them even farther up, wrist hyperextension. Okay, and relax. Now I'm going to check your ulnar and radial deviation. Okay, so we're going to put our hands flat on the table. What I need you to do is bring your thumbs inwards towards each other like this. That is ulnar deviation. Okay, now we're going to go the opposite way. That is radial deviation. Okay, oop. That is absolutely backwards. Radial deviation is towards the thumb. Okay, ulnar deviation outwards. Let's do that one more time. Outwards and outwards. Can you stop them for me? All right. Okay. That's okay. Now we're going to work on your fingers next, okay? So again, I had already assessed your finger joints, so I need you to point your fingers down. That is finger flexion. Okay, go straight. That is finger extension, and go upwards. That is finger hyperextension. All of those is intact. Now we're going to do abduction and adduction. Spread your fingers apart. That is abduction. Okay. Let's turn a little bit and face the camera. Okay. And bring your fingers together. That is adduction. Both of those are intact. Okay. Now I'm going to take a look at your wrist here. We're going to look for something called the snuff box. And the snuff box is this kind of squarish area right here on both sides. I'm looking for any abnormalities, any redness, any inflamed joints here. If she experiences pain, numbness, or tingling in these areas, we're going to be concerned for early signs of carpal tunnel syndrome or overuse syndrome. So that is the snuff box. And that is what I am assessing there. Okay. All right, now we're gonna move on to the hip joints. So I need you to just turn around while you're standing up. I'm just taking a look at your shoulder symmetry, taking a look at the height of your iliac crest, making sure that there aren't any, feeling around here for any nodules, abnormalities, anything out of place in the hips. I am not assessing that. So at this point, Debbie, I'm gonna have you get back on the table. Okay, and go ahead and lay back for me. Okay, so for the hip, we're gonna start with internal and external rotation here, okay? All right, so we're gonna go up, we're gonna do internal rotation and external rotation of the hip and rest, and then we're gonna go internal rotation and then external rotation of the hip and rest. Good, good, good. Now we're gonna do flexion and extension of the hip joint, okay? So I'm gonna bring this leg up. We're gonna flex, 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 and extend, flexion, extension, okay? Same thing on the other side. Flex the hip, extend the hip, flex it, extend it. All right, so now we're gonna I'm gonna have you spread your legs apart. Yes, just like that. That is hip abduction. Bring them back together. That is hip adduction. We've gone back towards the body. All right, now I'm gonna have you stand up again for this part. We're gonna do hip hyperextension. Okay, and for that one, turn around.
This way?
Other way.
The other way?
Yep.
Okay.
We're gonna donkey kick backwards, but watch Oscar. Okay, there we go. And do it on the other side. Okay, and that is hip hyperextension, which is intact. Okay, Debbie, now I'll have you sit back on the table here. I'm gonna take a look at your knees. All right, so again, I've assessed for warmth, tenderness, all of that earlier, any signs of abnormalities. I need you to bend your knee, so that is knee flexion. Extend it outwards, that is knee extension. All right, while we're here, I'm gonna work on the ankles. I've already assessed for any abnormalities. Okay, so for this one, I need you to point your toes upwards, okay? That is dorsiflexion, point them downwards. Point them downwards. That is plantar flexion. I need you to take your soles of your feet and go inwards. Okay, that is inversion. Take them and go outwards. Okay, perfect. That is eversion. Okay, now we're going to move on to your spine. I'm going to have you stand up again.
Okay.
All right. And for this time, I am also looking again for height and symmetry of the shoulders. I don't want one higher than the other. I'm looking for symmetry of the iliac crest. All of that looks good. I'm looking for a nice straight spine as she's standing up. Go ahead, lean over and touch your toes. All right. And as I'm screening for scoliosis, I want to make sure that I have a nice straight back. I want to make sure that I'm not seeing any kyphosis, any curvature of the spine. All right, and that all looks excellent. You can come on back up. Okay. Okay. We're going to do a little bit of spine movement here, okay?
Okay.
So I need you to bend to your left. Okay, that is spine flexion, back to the middle. That is spine extension. Let's do it on the other side. Left, okay, that is spine flexion. Middle, that is spine extension. All right, and now we're going to do rotation. So just cross your arms and we're just gonna go side to side here. Okay, all right, beautiful. And your spinal strength is intact, okay? All right, so now we're gonna do some strength testing. And as we're doing the strength testing, 5 out of 5 is normal against resistance. So that's what I'm gonna be looking for. All right, so we've already done the neck and we've already done the shoulders. But what I'm going to move down onto now is your biceps. Okay, so turn this way. Watch out, buddy.
You gotta move.
You gotta go.
Down. Down.
All right. All right, Debbie. Hold your arms out. Like this. Okay. Now every time you feel me, hold on. Turn this a little bit. All right. Every time you feel me, I need you to resist my hands. Okay? All right, good. Biceps, 5 out of 5 resistance. Turn around against resistance. All right, you're gonna feel me right here. Push against me. Okay. Triceps, 5 out of 5 against resistance. Turn back around. Okay, now we're going to, I'm going to do your grip strength. So look straight at me. Okay, squeeze my hands. All right, 5 out of 5. Get back on the table. Lay back down. All right, now push me away, spreading your legs. Okay, hip abduction, 5 out of 5. Okay, come towards me. Okay, hip adduction, 5 out of 5. Okay, now we're going to do your ankles. Push me away from me and flex your foot up. Okay, that is 5 out of 5 on dorsal flexion. Okay, now push down against the gas pedal. Plantar flexion, 5 out of 5 bilaterally. All right, next we're going to do some specialty tests here. Okay, we're going to do a straight leg raise. So I'm going to take this leg, we're going to go up, 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 45-degree angle. I'm going to dorsiflex your foot. Any pain?
No.
Okay, let's do it on the other side. Up, 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 dorsiflex the foot. Any pain? If there were, I would be concerned about nerve root impingement, but that was negative. Next, we're going to do ballottement. Okay, will you scoot back a little bit more for me? Need your knees flat on the table. Okay. So for ballottement, I'm going to put my hands on each side of the patella, and I'm just going to tap in the middle of each side, and I'm looking for the presence of fluid, a fluid shift, a little fluid wave. While we're on the topic of fluid, we're going to do the bulge test. And the bulge test, I'm going to sweep in your thigh and down the other side, and in your thigh, down the other side. And again, that is another fluid test. If I did see it, I would assess for fluid waves in this region. So that was negative. All right, now we're going to do the McMurray's test. And this is we're going to do the McMurray's test. And this one will assess for meniscus damage, okay? So I'm going to take your leg, I'm going to bend it, I'm going to extend it, I can't really see what I'm doing here. Okay. I'm going to bend it, I'm going to extend it, I'm going to internally and externally rotate it. And I'm listening for a click sound, which would be the presence of a meniscus tear. Internal and external rotation after the flexion and extension. So both of those are negative. All right, we're gonna do anterior posterior drawer test. Go ahead and I'm gonna flex your knees here. Bend your knees, bend your knee, okay? All right, we're testing for ACL. So I'm going to go right here to isolate it. I'm going to pull it towards me. Any pain?
No.
Okay. Let's go on this side. Isolate the ACL tendon. Any pain?
No.
Okay. Good. So that was the anterior posterior drawer test. Now we're going to do the Lockman test. I'm going to bend them just slightly. Okay. I'm going to pull above and below the knee. Above and below the knee. And again, that is also for ACL test. Was there any pain as I was doing that?
No.
Okay. Now we're going to do the valgus test. Valgus test is going to assess for MCL damage. So I'm going to put my hand right here on your outer thigh, and we're going to go laterally rotated. Any pain?
No.
Okay. Let's go on this side. Same thing. Any pain?
No.
Okay. All right, and then we're gonna do the Varus test, which is the same thing. On the other side.
No.
Any pain? Okay. And then we're going to externally rotate. We move laterally. Any pain?
No. He's another foot.
Okay. All right. Now, Debbie, you can go ahead and have a seat on the edge of the table here.
Okay.
We're gonna do something called the Tinel test. So I'm just going to tap on your median nerve here. Just hold your wrist out. Any numbness or tingling?
Mm-mm.
Numbness or tingling?
No.
Okay, excellent. If there were, then I would be concerned more about carpal tunnel. Okay, next we're going to do the Phelan test. So we're going to do upside down prayer hands. Okay, good. We would do that for a full minute. If you did elicit pain, then I would be concerned about carpal tunnel. Does that hurt?
No.
Okay, relax. Okay, the Sperling test. I need you to turn your head to the left, look kind of earlier like we did, bend to your ear, okay?
Oh.
And I'm gonna push down. Any pain?
Mm-mm.
Okay. If there were, I would be concerned about cervical radiculopathy. All right, go ahead and stand up for me, Debbie. Okay. Now, turn towards the camera. I need you to close your eyes. All right, put your arms out to the side, palms facing upwards, okay? And what I'm looking for, I'm just gonna push gently here. I'm looking for an arm drift test, and I do not assess any of our arms falling. Okay, go ahead and put your arms down by your side. Perfect.
Can I open my eyes or keep them closed?
Keep them closed.
Okay.
We're gonna do that same thing again, okay? Palms up, okay? That is full can. Now we're gonna go ahead and point down, your thumbs down, and that is empty can. That is checking for any supraspinatus issues. All right, you can relax and open your eyes. All right, Finkelstein. What I need you to do for this assessment, Debbie, you're gonna follow my lead here. I'm gonna put your hand on the side of the table, okay? Come over here. Just watch me the first time, okay?
Okay.
And then you're gonna swap with
Okay.
me. All right, we're gonna go like this. Just
Okay. Okay.
extend your wrist, okay?
Okay,
And
yeah.
we're gonna do both sides,
Okay.
okay?
Yep.
This is the Finkelstein test, okay? And if that did elicit any pain on either side, then that would be concern for Quervian's tenosynovitis.
Okay.
Okay, great. Now, Debbie, go ahead and have a seat again.
Okay.
We're just gonna go over some general questions. So tell me where you are right now.
In my dining room.
Tell me what day of the week it is.
Monday.
Okay, my patient is alert and oriented ×4. How's your mood?
Great.
Okay. I'm also going to be looking at her affect along with that to see if it's congruent, and you can see that she's smiling, she's grinning, she is happy to be here. So mood and affect are congruent. She's relaxed, she's not restless, etc. Judgment. Debbie, if a fire broke out right now, what would you do?
Run out of the house with my dog and call 911.
Excellent. So you have good judgment. All right, I'm going to say a color. You tell me what object comes to mind.
Okay.
Red.
Rose.
Rose. Beautiful. So abstraction is also intact. All right, now we're going to do deep tendon reflexes here. Okay. So I'm going to go ahead and test the biceps. Just rest like a noodle. All right, here's bicep. Oh, good. Bicep. Okay. Radial. Okay. Go ahead and rest for me. We're going to do triceps from behind here. Okay. That moved. Dangle a little bit. Yeah, perfect. Okay, excellent. All right, now I'm going to move down to the knee and the patellar joint. I'm going to locate the notch right here. All right. Good. All right. Good reflexes. I'm going to come down here. I'm going to test the Achilles, so I'm going to go ahead and dorsiflex this foot a little bit up here. Okay, I'm gonna tap back here. Okay, and we saw her foot flex upwards. Okay, and again. Okay, Achilles is intact. I'm also going to check for clonus while I'm down here, so I'm going to point her toes upwards. And these are normal. This is a normal response. If she were to be bouncing her toes as I pointed upwards, that would be indication of clonus. Okay. Now we're going to do the Babinski reflex while I'm down here as well. You don't like this one? Okay. So I'm looking for her feet to point, her toes to point downwards as I'm doing this. Because if it points upwards, that's an abnormal response. That normally goes away in after the age of 2 years old. Okay, this is the last section here, Debbie, and it's what I find the most fun. Okay, so first I'm going to check your position sense. Okay?
Mm-hmm.
All right, close your eyes for me. Okay, tell me if I'm touching your fingers up or down.
Up, down, up, down, up, up, down, down.
Okay, bilateral upper and lower extremity position senses intact. We're going to do vibration next, hands on your lap. Okay? Tell me when you feel this. Close your eyes.
Yep. Yes. Yes. Yep.
Okay, beautiful. All right, now tell me if I'm touching you with something sharp or something light, okay?
Mm-hmm.
This is to test your bilateral upper and lower sensation.
Soft. Pointy.
Uh-huh.
Point.
Uh-huh.
Soft.
Uh-huh.
Oh, pointy.
Uh-huh.
Soft.
Uh-huh.
Pointy.
Okay, yes, perfect. All right, now I need you to still keep your eyes closed here. We're gonna do something called stereognosis. Okay, keep your eyes closed. I'm gonna put an item in your hand. You tell me what this item is in your hand, just by feeling it.
A key.
Excellent. So stereognosis is intact. Now I'm gonna draw a letter in your hand or a number. You tell me what it is with your eyes closed.
3.
Perfect. That was letter 3. So graphesthesia is intact. All right, we're gonna do 2-point discrimination. Now tell me when you feel 2 points hitting your body, okay?
Okay. Yes. 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 Yes.
Okay. 2-point discrimination is intact, bilateral uppers and lowers. Okay. Now go ahead and open your eyes. We're going to do some cerebellar tests with some rapid alternating movements. I need you to take your thumbs to your finger. 1, 2, 3, 4. 2, 3, 4. 1, 2, 3, 4. All right. That is intact. Take your hands to your lap. Go rapidly back and forth. Okay. Rapid alternating hand movements are also intact. Take your nose and go to your finger. You know what I mean.
Your finger to your nose.
Your finger to your nose, your finger to your nose. Beautiful. Cerebellar's intact. All right, go ahead and stand up for me. We're going to do pronator drift real quick. I need you to face towards the camera, arms straight, palms up, eyes closed. Palms up,
Oh, sorry.
eyes closed. All right, and what I'm assessing for is a drift in either extremity here while her eyes are closed. I'm not assessing any. Hands by your side. We're going to do the Romberg test while we're here. You keep your eyes, open your eyes. Okay, now I want you to close them. All right, I'm going to assess her for about 20 seconds. If at any point I see her falling forward, that is a positive Romberg test. Okay, now Debbie, stand back a little bit here. We're going to go heel to shin, okay? So I need you to take your right heel and trace it down your shin. Okay, on the other side, heel to shin. Beautiful. All right, we're almost done. I need you to, I'm going to assess your gait next. Just walk towards the camera for me, normally, and back. I'm looking for any loss of coordination, any shuffling gait, things like that. Now we're going to do tandem walk. So you're going to put one foot in front of the other as though you're taking a DUI test, okay?
Yep.
All right, and I'm going to assess how you're walking there. Believe me, I believe I am. Okay. All right, now I want you to walk back on your toes. You can do it. Good job. All right, let me get the camera set back up here. Okay.